Mr Acting Deputy President, for the early call. Honourable Senators, I rise to speak on the Health Insurance Legislation Amendment, Transparent Patient Outcomes Bill 2021. The bill, if it finds favour with the Senate, will allow the Minister for Health to establish public databases of surgical procedures and patient outcomes to allow consumers who are considering a particular procedure to make an informed choice about their practitioner. The mover of the bill, my South Australian colleague, Senator Griff, argues in debate that such information in the public domain will allow Australian patients to objectively assess skills and outcomes of individual practitioners, and the bill will repair a lack of transparency that currently exists in the, I suppose I could describe it as, consumer market for medical services. The bill technically seeks to amend the Health Insurance Act 1973 to enable the Minister to make rules to establish and maintain a transparent patient outcomes register, or registers, as the case may be, that contain data such as the number and type of surgical procedures performed at a facility, and the number and type of procedures performed by a practitioner, surgical revision rates and patient mortality rates for each facility and practitioner, any prosthesis device used, patient demographics or any other information set out in the rules by the Minister. The bill, in effect, gives the Minister wide discretion to effectively construct or structure the nature of the register or registers, and registers can be for particular surgical interventions and also relate to particular medical professions. So there is a degree of flexibility and empowerment of the Minister to do so. And as we've heard from Senator Askew, the government's intention through its Minister for Health is to consult widely in relation to this bill and share those findings with the mover of the bill to see the best way forward, or whether this bill may require further refinement. So this bill raises two interesting issues. One, around privacy, which it does take great pains in the terms of the bill to protect, and also, which is touched upon by Senator Kitching, the nature of the interpretation or the presentation of that data, which will empower the consumer, which we hope will empower the consumer and not confuse the consumer. And I'm also interested in relation to this bill, how that will impact the performance of the medical profession as a profession. The last two, the interplay between the delivery of the information and how the profession, both as individuals in the profession and the profession as a whole, will respond. We hope positively if this bill is passed. Now, on the issue of privacy, Hippocrates, the physician, pledged to keep information about patients private and confidential. So this is not a new concept, and in fact the Hippocratic Oath states that where I may see or hear in the course of treatment or even outside the treatment in regard to the life of men, old language, which on no account one must spread abroad, I will keep to myself. So it's not a new concept, and it is one which we've grappled with in the past. This bill aims to keep the balance, that is, to collect the data for societal benefit whilst protecting the individual. But to gather the data, it has to be protected, otherwise it will be used for a variety of other purposes and therefore will prevent the ultimate collection or the validity or our ability to rely on that data and undermine its validity. This is an old trade-off which has occurred in health, and the trade-off is being extended to allow the creation of these registers. To quote a paragraph from Senator Griff, the bill endeavours to strike a balance between providing useful information to guide patients, providing ongoing protections to those who, in good faith, provide, collect and manage performance and outcome data, and also endeavours to ensure registry information is not appropriated in unintended ways, such as for court proceedings. As I've said, this is not a new concept. Personal privacy is often used to protect individuals. Protecting personal privacy is used. The protections to protect personal privacy are always used to protect the interests of individuals. The primary justification for collecting personal identifiable health information for health research is for the benefit of society. And as I said, it's an old balance and one which I think is maintained in the bill. In preparing for the debate today, I'd like to thank Sterling Griff for preparing a statement of compatibility with human rights, which I found informative and also alleviated potential concerns that I may have or others in relation to privacy. I quote the conclusion: "This bill aims to assist individuals to access information about a healthcare provider and exercise informed choice before proceeding with surgery, and so it's compatible with human rights as it promotes the right to a high standard of health, the right to control one's health and the right to information accessibility." And from my own perspective, I do not find fault with those assertions and have considered the arguments of the mover carefully. What has particularly interested me about the issues raised with this bill is how it interplays with the profession. Historically, we have relied on the profession, the medical profession, to self-regulate. In effect, we have placed our trust in the medical profession and the doctors and surgeons within it, and we have not sought to question their counsel or their wisdom. Society has moved on apace, and individuals in our community want to have a dialogue with their doctors and specialists, and in that dialogue they want to be informed. And that is why the seed of this bill has great attraction, because it empowers the consumer to have a dialogue with their medical profession, not necessarily on equal terms, because in a medical patient, a doctor-patient relationship, there is a lack of power. One has great knowledge, one is ill and concerned for recovery. So the relationship has never been equal, which is why the profession was created, to create some balance and self-responsibility on those providing the care. When discussing professions, I always come back to an Australian Bar Gazette article, which was a reprint of a part of a presidential address delivered by Mr Hilton to the English Law Society, titled "The Nature of a Profession." And one of the really attractive arguments about professions, and he's referring to both the medical and the legal profession, the latter of which I'm a member, is that before something can be called a body, a group of individuals can be called a profession, they must follow their trade or craft in the spirit of public service. It doesn't rule out the need for fair reward. The point is that the first care is to apply all the person's knowledge and energy and abilities in doing the job, and earning reward is incidental to that. But as the mover of the bill has indicated, that is not always the case in any profession, and there have been considerable failings in the medical profession to clean up, might I say, its own dirty linen. Senator Kitching also indicated that there may be different behaviours as a result of the data. For example, because it's aggregated, it may result in a debate with the patient that's not as necessarily as informed. I like the fact that, and I think, if I don't really want to speak for the mover, but as I understand his contribution to that, he wants a conversation, an empowerment conversation. It does not necessarily mean that this data will inform the patient to the nth degree, because they are not data experts, but it will allow them to come to the surgeon's table, desk I should say rather than table, or the doctor's surgery and say, well, this is the public data. Please explain to me why you think this surgeon's the best. And I think that's the attractiveness of this legislation, because no legislation like this can generate perfection. One of the interesting things, and I don't profess to have a crystal ball in relation to this, is how the profession will respond. Now, it could be that the lesser noble members of the profession, those who do not put societal benefit as one of their primary drivers in the profession, and say and remuneration is higher to them, might reduce their scope of practice and only operate on those that they think is going to have a greater recovery. One would like not to think so. So my point of raising the interplay with the profession is the profession will have to do more work with this to ensure that their members do not respond in a base way to this sort of data being held by the patient. It will also, I think, have positive knock-on effects for the procurement process, particularly with prosthetics, because we know that there are very, very hard sales techniques around prosthetics, and the patient needs to know, are they getting the one that is used in majority or specialist, and then raise the question. It may also drive in the profession increased specialisation and more attention to those being apprenticed, and their apprenticeships take longer. I don't raise those issues to negate the positive intentions of this bill, but to raise them to promote the debate about how this register will be structured. As my honourable friend Senator Askew has indicated, the government finds favour with the intentions of this bill. It's seeking to consult to better understand how the registers will be constructed. Can I congratulate the mover of the bill for his dedication to advancing the interests of patients in Australia.
Senator McLaughlin, I believe you're seeking leave to continue your remarks.
Yes, sorry, Deputy President, I am seeking leave to continue my remarks.
Is leave granted? There being no objection, leave is granted. I think I'm calling the clerk.
Government Business Notice of Motion number 2.